My name is Alex. I am 20 years old. I am from Austria and I just landed in Istanbul to get my rhinoplasty here, and I'm feeling really excited. The reason why I chose him is because I really loved his work, and he's a very experienced doctor here, and from everything that I've heard from his patients, everything is just really good, and I really love the way that he is also doing male noses. The research I did was, of course, how the whole work is, how are the noses looking, and also how experienced the doctor is, because everyone has their own signature look, and I just thought the way that he's doing noses is just really perfect for me. I chose Istanbul for my surgery because I've heard the doctors here in Istanbul are just very practiced in doing rhinoplasty, because so many people come here because the doctors are really excellent, and from the whole service, for example, like you're getting picked up and everything, it's just really amazing.
Our patient has an axis deviation to the left side and septum deviation to the right side. Especially at the bottom of the septum, as we say, columella is deviated to the right side. And the tip of the nose is droopy and he has a prominent nasal bridge. We will remove the bridge, fix it at the midline and upturn the droopy of the tip. We plan a nose fit to the patient's face. It's very important to look masculine, not overturned and not curvy nose. When our patient is a man, nose have to look masculine. If a woman, the nose has to look feminine nose. Together with the patient, we try to determine the appropriate nose using the Photoshop program. This will be our aim. With the operation, we try to obtain very similar to the Photoshop aspect. Especially it won't be exactly the same, but it will be very similar. The patient takes blood test before operation. After midnight, we ask to a patient doesn't eat anything or drink anything. Before operation, we would like to him not to consume smoking or alcohol. We will apply open technique in our operation because open technique allows us to have more details in operation. Additionally, in open technique, we can use better like piezo or micromotor devices.
So right now I am feeling, of course, a little bit nervous about the operation, but mostly I'm just really excited to finally really see my nose, and I have full trust in the doctor, so I'm ready to go. The best advice I would give, if you really want to do this, don't delay it. Just do it, you only live once is just, my motto, and I'm just so excited to see my new nose. It has been such a dream of mine, and just relax, it is not that big of a deal, you're in really good hands here, and just do it.
Hello again, our operation was finished. We fixed all the problem. We haven't any problem now. We removed the hump, we fixed the ax and the septum deviation, and we turned up the droopy nose. And now our patient doesn't any pain. We will send him to our service room. Everything is okay.
So now that my rhinoplasty is over, I had a wonderful experience the whole week. I wasn't in too much of a pain, and the whole team was just very nice, from the doctor, especially to the assistant. I had so many questions before the operation and also after the operation, and they were always so kind to, answer me every question I had, and they assisted me very well in the whole process of recovering. So I really loved the experience. I wasn't really happy with my nose before, and now I just really love it. I got my cast removed today and I love the shape. It was exactly how we talked about it before the operation, and it really looks like the simulation picture, and I couldn't be happier with the end result. So if you're thinking about getting rhinoplasty, I think you should just do it. I was also contemplating a lot if I should really do it right now, but there's not a lot to worry about, and I think you should just do it and you would be very happy, just as happy as I am with my new nose.